How can families prevent TB at home without overwhelming caregivers? Preventing tuberculosis transmission at home can seem challenging, but with simple, effective steps, families can protect each other without adding stress. The key is to focus on practical measures that reduce airborne bacteria and support the person with TB while keeping caregivers comfortable. First, prompt medical diagnosis and treatment are crucial. The person showing symptoms should see a healthcare provider immediately. Starting the right medication under medical supervision helps make them less infectious faster. Often, healthcare providers recommend directly observed therapy, where a health worker watches the patient take their medication, ensuring adherence and reducing the risk of spreading TB. Next, practicing good respiratory hygiene makes a big difference. The person with active pulmonary tuberculosis should cover their mouth and nose with a tissue or cloth when coughing or sneezing. Proper disposal of tissues is important to prevent bacteria from lingering around. Good ventilation is another simple but powerful tool. Keeping windows open or using fans to circulate fresh air dilutes the concentration of airborne bacteria inside the home. Spending time outdoors or in well-ventilated areas further lowers the chance of transmission. Limiting close contact is also vital. The infected individual should avoid spending long periods in shared spaces like kitchens or bathrooms, especially during the infectious phase. Family members, especially those with weakened immune systems, young children, or older adults, should try to avoid prolonged close contact when possible. Wearing masks can help too. The person with TB may wear a surgical mask when around others to contain infectious droplets. Family members who are not at high risk generally do not need masks, but during active infectious periods, masks in shared spaces can add an extra layer of protection. Visitors should be limited to essential health care workers, and the person with TB should avoid going to work, school, or public places until they are no longer infectious. While surface cleaning is always good for overall household health, it's important to know that TB is not spread by touching surfaces. Still, maintaining good hand hygiene and cleaning common areas supports overall infection prevention. Educating everyone in the home about TB transmission and prevention helps reduce unnecessary fears and encourages practical precautions. Families should work closely with healthcare providers who can offer tailored advice and monitor treatment progress. This partnership ensures that precautions are effective and manageable, preventing caregiver overload. By focusing on ventilation, respiratory hygiene, limited close contact, and timely treatment, families can create a safer environment that minimizes TB spread without overwhelming caregivers. Following these evidence-based steps aligns with public health guidelines and respects everyone's well-being, making home prevention both effective and sustainable.